Can you imagine trying to push a baby out and trying not to poop? That would be the worst thing you can do while you're pushing it. Hey, I'm Amanda, mom, doula, childbirth educator, and birth nerd. Welcome to Let's Talk Birth, the podcast where we get into real birth stories, talk through the awkward stuff, and cover the things nobody told you about. So grab your raspberry leaf tea, get comfy, and let's talk birth. Hey, welcome to Let's Talk Birth. My name is Amanda, and this is my sister, Kirsten.
Hi.
So this is our first Q&A episode, and we are just going to go back and forth and talk about birth. Kirsten, why don't you introduce yourself?
So my name is Kirsten. I am a mom to two little ones. Elias is going to be 3 at the end of this month. And then I have Nora. She just turned 1. And I also am a doula, pretty part-time right now, just because with young kids it's a little bit harder. Yeah, that's a little bit about me.
What do you like about birth?
Gosh, what do I like about birth? Honestly, birth to me is probably the most spiritual, like the most spiritual experience ever. And so as far as being a doula, to be, graced with the honor of being in the room with someone giving birth, like that is such a beautiful experience to just be around, but also being able to champion the woman and help her feel empowered to write her story of birth, or for her to be able to live it out, to me is just so beautiful. Yeah, I love it.
But yeah, so that's why she's here. She has, like I said, different experiences in the birthing room. Her two births have also been very different than mine, which is one of the other reasons why I love that she's here, because her personal experience is different, her professional experience is different, and although we do have the same philosophy for the most part, we do have different perspectives on a lot of things. So I feel like you'll get a fairly well-rounded answer from both of us, from the combination of us too, when you ask questions. That being said, if you have a question, go down to the show notes right now, click the link, and fill out the form. It's completely anonymous. There's no judgment. There's no shame at all. And these questions are legitimately questions from a friend of mine who has not given birth before, is not pregnant, knows nothing about birth. I literally asked her to give me all of the questions that she can think of as a prospective new mom. I'm very excited to dig in, so let's get started. What are the most common fears first-time moms have about labor, and how can they work through them?
Gosh, honestly, I think the most common the most common fear, it really is pain. How painful is this going to be? And how they can work through it, honestly, is just preparing a mindset beforehand. So for me, when I'm with my clients, usually in the first meeting, what I'll do is I'll have the mom just close her eyes and envision what type of birth she wants, what kind of feelings she wants to feel, and things like that, like who she wants to have around her. Just really try and visualize it as best she can. And honestly, what that does is that prepares her so that way, as things go along and when she's in the heat of the moment in labor, she's able to, hopefully be able to bring all of those things that she wanted. So like, for example, me, I wanted to feel joy, and I wanted to feel peace, and I wanted to be able to smile. Like those were my big things, is I wanted to be able to smile. And so having gone into labor with that already pre-established, I was able to hold on to that. And that kind of helped me go through it. And I know that's helped some of my other clients where they've remembered, oh, this is what I wanted to experience. And they've been able to, in that mindset, be able to foster that in that atmosphere. That's been able to help them get through it. And I also think just on a physiological level, when it comes to pain, the more you allow your body to do what it needs to do and just go with the flow, the better it is. Like you're not resisting it. You're allowing your body to do what it needs to do to bring this baby earthside.
Yep, I completely agree. I do the same thing with my clients. I actually stole that from her. I similarly have them close their eyes and picture what they want their birth to look like. And I typically go through the 5 senses. So when you want comfort, what smells comfort you? What smells relax you? What what things to look at. Like, do you like looking at a beach? You should bring a picture of a beach with you. Or maybe like the baby's clothes, because that's like a goal to get to. Like, you're excited to put the baby in this outfit. Or what's some stuff that you can listen to help you relax? Like, is it, classical music, or is it Uptown Funk? Like, it could be anything, whatever can get you
white noise,
relaxed. Yeah. Or just earplugs, like straight up nothing, which is me. I am earplugs. That is my birth mode. But the other thing that I have seen moms be afraid of legitimately is pooping while in labor.
Yeah.
And I'm going to be real, guys. It happens, and it's not a bad thing. And nobody in that room is going to be embarrassed or bring it up. None of the birth professionals are going to say anything about it other than compliment you on your pushing, because when you're pushing correctly, it's using the same muscles and the same method as when you are having a bowel movement. And it's...
yeah, your body is just wanting to expel whatever it can.
Yeah.
It's such a small, insignificant part of the birth process. Like, it doesn't really, like, it's there one moment and gone the next.
Yeah, and can you imagine trying to push a baby out and trying not to poop? That would be the worst thing you can do while you're pushing, is to hold back. The last thing that I know I've heard a lot of moms are afraid of is tearing.
Oh, yeah.
And tearing is natural. It happens. It doesn't have to happen all the time. There are ways that people say you can do to, like, things you can do to prevent it, but that doesn't, everybody's different. That's going to be a theme I'm not going to stop saying ever in this podcast, is every body is different and every birth is different. From my first to my second were very different births, very different pregnancies. When you're pushing, the only things that you can do to prevent it are really to take your time and let things stretch. Like, doing a massage beforehand could be helpful. There's not a ton of evidence on that. Having a warm compress while you're pressing, if you can ask your midwife or nurse or doctor to hold a warm compress on your perineum, that's helpful, because that'll help it relax and open up. But ultimately, when you get to the ring of fire, which feels exactly how it sounds, when you get to that point, take a deep breath and relax and don't push anymore. Just let it stretch. And there's going to be a point in time where it doesn't burn as much anymore. And once it stops burning, then you can proceed.
Yeah. So, even changing your breathing, like pursing your lips and blowing out like you're blowing out a candle, in addition to going to your knees. If you're in a standing position, like I was, and I'll talk about that later on, for both of my kids, I was in standing position. One of them, I ended up moving to a kneeling position because I felt like things were progressing so quickly. Sometimes talking to your baby helps, and kind of getting that mind-body engagement. Yeah, those are just some things that come to mind for me.
Because you told Elias to slow down,
I told Elias to slow down. I told Nora to slow down. They were quick. They were in a hurry.
Me with Aiden, it was very similar, but instead of, because I wasn't talking to him, I was talking to me, I just told my body, okay, out loud, I said, okay, chill out a little bit, slow down, don't push too hard, don't do this too fast. And yeah, it worked really well. Moving positions also helps prevent tears. A lot of it is just moving intuitively, and honestly, tearing is not the worst thing in the world. It really isn't. I haven't had anything more than essentially paper cuts in my births. And even then, for me, it was a lot of stinging for the first couple days of whenever I urinated, and that was it. And even then, you just use a peri bottle and spray it while, on yourself while you're peeing. But Kier, you tore with Elias a little bit, right?
I tore a little bit, and I did need she said you could go without stitches. My midwife said you could go without stitches and it'll take longer to heal, or you go with stitches and it'll take less. And I was like, I'll choose less. And honestly, I didn't get any of the stinging or anything like that. I was totally fine. But I know with again, like you said, it depends on the body. So there's women who their birth was what's called a precipitous birth. So it was 3 hours or less. And that baby was coming, super quickly, and they didn't tear at all. And then other women who, they were in labor for a long period of time and they tore pretty significantly. and even in the middle. So it really just depends on the body. Yeah. And I would even say, like, in that same vein, I've heard other women say, does everything go back to the same or whatever? And honestly, the answer is yes. Like, your body stretches in the same way that your stomach stretches out. And then after postpartum healing and everything, things usually go back to normal. Same thing with the rest of your body. It just takes time.
Yeah, it takes time. And here's the deal. We're going to breach this topic a lot earlier in this podcast than I anticipated, but sex after birth is not the same. You have to go slower, and you have to be not afraid to use lube, because your body is like, it's the same. It's not stretched out, but it's also a little different, because it's just, there's some parts that are a little more elastic than others, and some that are a little tighter than others, just because you've been abstinent for so long. Like, the period of time minimum, like, that is suggested as 6 weeks because of the dinner plate sized wound on the inside of your body. You don't want to get infection. You don't want to irritate that. So when you wait that long and your hormones are not ready for you to have hanky panky time, you need to be okay with using lube, and there's no shame in the lube game.
Yeah.
Okay, next question. What surprised you the most about labor the first time?
Okay, so for me, honestly, I think the fact that I was in labor. I was so convinced that you've seen Hollywood. Like, you've seen the movies where labor, when a woman is in labor, it starts with her water breaking, and it's this terrifying thing, and you rush to the hospital, and you're so concerned about what's happening, and then you give everything over to the doctors, and they do whatever, and then you just lay on your back and whatever.
And screaming.
And you're screaming and all this, everything going on. So for me, I went into labor the first time thinking, okay, Amanda, you have Prodromal labor, thank you. Prodromal labor. So you experience labor for an extended period of time.
Yeah, basically.
So for me, I'm like, okay, so we share genetics. Maybe I'm going to experience that. So I'm mentally prepared. Okay, I am just like, I don't really know when I'm going to be in labor.
And you did doula training before, like you did your doula training before having Elias.
So my story when it comes to doula training was I had gotten pregnant, and it ended up ending in a miscarriage, my first baby. We named him Isaac. And then I started to get really interested in just everything birth, because I obviously was going to have a baby. And I have always, I would say, been more on the hippie side of things.
Yeah, same.
And because I had medical conditions, like skin conditions, and my interactions with the medical field were very short, not necessarily sweet, and I would always walk away with a new prescription. And it never really solved whatever issue I was going with, which is a whole other thing. But that was my kind of introduction, or my relationship with the medical field. And so I was looking into alternatives. Midwifery, you had a home birth. And so I was, just kind of looking into the world, home births and everything like that. And I came across a friend who was a doula, and I ended up sitting down with her, getting coffee, and she just told me everything about the doula world and what doulas do and about birth. And I was like, oh my gosh, this is amazing. I've always loved just the body and just learning about the body. And this is, for me, it was the perfect marriage of being able to support a woman and help empower her, as well as be able to be super knowledgeable in the medical field, which again has always fascinated me. So that was kind of my introduction into it. But when it came to my birth, first time moms, typically statistically their labor can last, anywhere from 12 to 48 hours. And so I had mentally prepared for that. I had mentally prepared to push for, I think it was 2 hours minimum. I had mentally prepared to go 41 and 2, which is, again, the first,
41 weeks in 2 days.
Yes, 41 weeks in 2 days. Statistically, that's what first time moms go to. And so I was, ready for all of that. And the way I oriented my life around my due date was I was planning things because I didn't want it to stop me. I wanted to be able to look forward to life and just keep going on as everything was normal until it wasn't.
Which is something we absolutely advise our clients to do.
Yes.
And you to do.
Yes.
When it comes for your due date, plan to have like a fun day. I plan for basically all of mine to like go see a movie I'm really excited about or something, so that have a date night. So then when the day comes and there's no baby, you still have something to look forward to that day.
Yeah, absolutely. Just continue on with life as normal, or plan things, to celebrate what's going on in your life. And so for me, I went into labor at 39 weeks and 2 days. Yeah, I was Elias was 5 days early. And for me, I was going on with life as normal. And then all of a sudden I'm in labor. Didn't really believe it because
she didn't. She had to FaceTime me.
Yeah.
And I told her, I looked at her husband who was standing behind her as she was having a contraction. And I'm making eyes at him like, this is it, dude. I had not attended any other births at that point in time. But I knew from my own experience twice now, this is what labor sounds like. She's not just having prodromal labor contractions. She's not having Braxton Hicks. This is the real thing. You should probably contact the midwife.
Yes, and we did. Yeah, I won't go into too many more details about my birth because I want to save it. But definitely what surprised me was actually being in labor.
Yeah, for me with Jacob, I talked about it in the first episode a little bit more in detail, but when it came down to it, it was a mental game more than physical. I was handling it like a champ. At one point, I actually told my husband, like, I wish I could pause it right now because I just wanted a nap. I was so tired. It wasn't even, like, I knew if I was in a hospital, I probably would have gotten an epidural at that point because I was so tired. Not even because of the pain, just I needed a nap. But more so the mental game of it, the getting stressed out about how long it's taking and why nothing's progressing as much as it should be, quote unquote should. But it was 100% in my head, 100% of the birth, until I had that conversation with my husband about, I don't want to invite anyone else over because I'm so stressed. Like, I'm already feeling like I have this pressure to perform for the 4 midwives at one point, 4 midwives in my living room, in my 1-bedroom apartment. Like, I did not want to have
pressure.
It was, and I didn't want to have, like, I wanted you to be there. I wanted Mom to be there. I wanted Deb to be there. My mother-in-law.
No, I didn't make it.
You didn't make it to the second one either. But yeah, I ended up saying I don't want them there. And as soon as I was able to verbalize that and hear that be said, my labor started progressing more. And I realized, looking back, it was all in my head. And that is one of the main things that I work with my clients is mental work, mindset work.
Yeah.
We talk about just getting used to calming down your mind and really focusing on the present and letting go and releasing yourself into the contractions and really working with your body.
Yeah. And I mean, for me, I have more of like an athletics workout mindset when it comes to that. And so for me, like I used to run, and when I would run, I would set these mini goals. And so, in the moment, I'm like, if I look at how long I have left, I'm like, this friggin' sucks. I want to stop right now. But I would look at myself and be like, okay, after that bush, I'm going to get to that bush and then I can walk for a little bit. And then I would get to the bush and I'd be like, wow, I just did that. And then I would be like, okay, I'm going to run and then up until the crosswalk and then I'll start walking. And I just kept creating these goals, these mini milestones for myself. And that actually allowed me to progress further than I thought I could. And similar with birth, it helps when you're like in the moment, you're like, okay, I have one more contraction. I have another contraction. Okay, I've got this. And self-talk really is amazing in birth, like in working out and in birth and everything. Like the more positive self-talk that you have, the better mindset and the better your body does through the process.
Okay, next question. Is it even possible to have a natural birth in a hospital? What do I need to know going in? So I actually have had a natural birth in a hospital now with my third. It wasn't supposed to be a hospital birth, but we'll get to that later. Yes, it is. I've attended a few.
Would you count that as natural because you were technically induced?
I was
induced. They did technically give you.
Okay, so that's the thing is it depends on what your definition of natural hospital birth is. A natural birth, no medication whatsoever, no induction, no continuous monitoring, no IV, no pain meds, or is it just no pain meds, or
is it no
pain
epidural?
Meds? Yeah, pain meds, but no epidural. Like where you draw the line, it depends. So yes, it's possible. I do consider my birth with my third a natural hospital birth because all I got was a cervical softener. That's side effect is it causes contractions, and I was already having contractions. So it just kicked things into gear, and there was nothing else after that. I didn't even finish the full dose. Not to get super into it because I literally have a workshop that's coming out in a couple weeks that is on that topic, the 3 secrets to a natural hospital birth. You can sign up for the wait list in the link in the description. But yeah, so the 3-ish secrets are just being in the know, knowing what your options are, knowing what the policies of the hospital are, and that you don't, like, that's their rules, that's not your rules. It covers their butts, it doesn't help you necessarily. And knowing what your birth plan is, basically, and we'll get to that in a minute, but that knowing how to handle the pain, different pain management techniques that are helpful, that are not medical, or not pharmaceutical, sorry, because one of them I was disappointed I didn't get to use it, is sterile water injections.
Yeah, see, I have always been so fascinated by that. I think that's so awesome.
Me too. So basically what they do is they just inject water into your back, which is, it sounds weird. It sounds like, how would that work? But basically it's gate control theory, which is...
Totally works.
Yes, absolutely works. And it just confuses your brain a little bit on where the pain is. I don't know. Is it over here? No, it's over here. No.
It's like when you stub your toe and like bite your tongue, your brain is confused on which one to respond to first.
Exactly. So when you have that, and it doesn't hurt necessarily, but that's one thing I've always secretly wanted a client to get, and then I wanted to get, but I didn't end up doing because I had her too fast. But yeah, you just know what your options are. Practice different pain management techniques at home so you know what you prefer. Because you could love a hip squeeze or you could not love a hip squeeze. And like I've said before, every birth is different. And
also, yeah, I would say like even in the preparation, you're loving something, and then even in the moment, you're like, get away from me, don't touch me.
Oh yeah, because I loved hip squeezes in pregnancy and in labor with Jacob. But then with Aiden, I love them in pregnancy, but my husband tried to give me a hip squeeze while I was in labor, and I was like, what are you doing in here? Go into it. Like, I don't need you.
Same. My husband tried to give me a hip squeeze, I think, and I was like, please stop touching me. Like, this is not helpful.
Yeah. So yeah, that, and then the environment, knowing how to cater the environment to your hormones and to kind of biohack your hormones a little bit. Something that we know is adrenaline puts you into fight or flight mode. You do not want to be in fight or flight mode when you're in labor at all.
Yeah.
And oxytocin and melatonin are the 2 best friends that help contractions move things along. So think relaxed, sleepy, lovey, snuggly, like that kind of hormone. So you need to be more relaxed and less stressed out. And so catering your environment both mentally and physically to biohack those hormones.
Yeah, I've even heard of women who like, and I've recommended women bring their own pillows, their own blankets, robes, just things that smell like them and smell like home into a hospital, so that way they can create the atmosphere and biohack, trick their brain to thinking, oh, I'm in my space. Because that's why with the whole home birth movement, that's why it's taking off so much, is because you're able to do it in your space. And that's not every woman can do that. Which is totally fine, but trying to bring your home into the hospital as much as you can really does help create that atmosphere of your home where you're the coziest.
Yeah, my favorite trick actually is to not bring your pillow, but to bring your husband's pillow, because it smells just like him, and not in a like sneaky man way, but like in a snuggly, this is what I smell when we're sleeping way. So
that's cute. Yeah, and I would also say going into your hospital birth with a birth plan actually, I would say, helps you the most. Because I heard someone talk about what are things that they should do to prepare, and that honestly was the top on my list, because you don't want to go into the hospital or wherever and all of a sudden try and answer all these questions. Because number one, as a parent, you're going to want to do your research, and that's healthy, that's normal, that's actually really, really good. it's really good to do your own research. And so when your doctors are asking you various questions, you don't want to have to like take a second and be like, okay, let me like stop this labor, look for 10 minutes, ask ChatGPT what's the best for me or whatever. Like you want to know going into your labor, like handing your birth plan off to your doula or your spouse or whoever is on your birth team and saying, these are my preferences. I don't have to think about them because I already did. And that relieves so much stress, and whatever chaos it could feel like is in the atmosphere is immediately alleviated because you know what you're doing. You're going in with a purpose and a plan, which really helps mitigate a lot of the stress and fight or flight where you're trying to like figure out what you want to do in the middle of the moment.
Yeah, that actually leads right into our next question, which is, what is a birth plan? Do I really need one? And the answer is yes. The best way I can say it is yes or no. No, if you don't care about your birth. And I am not saying that in any kind of a shameful way, like that there's no judgment in not caring. We all have different priorities and different preferences, and you might just be like, whatever, they're the professionals, go for it, do whatever you think is best for my body, which is totally fine. I know moms who have done that. Like, there's no judgment. But if you don't lean that way and you do have preferences and opinions about your birth, you need a birth plan. And when we say birth plan, we're not saying this is the step-by-step blueprint to what my birth should look like, 100%. No, it's what are your birth preferences? What are the options that you're probably going to be given? What is your opinion on each of them? Do you want to have morphine, or would you rather have fentanyl, or neither? And yes, fentanyl is used in labor. It's not the same kind as street fentanyl. I've had that question. I'm just putting it out there. It will not get you addicted.
Yeah.
But just knowing ahead of time what your preferences are for positions. Do you have a position that you really want to try to birth in, like to actually push in? Do you have positions that you want to try while you're in the first stage of labor, while you're just having contractions in early labor and active labor? Or
how often do you want to be checked? Do you want to be checked?
Yeah. Who's going to cut the cord? Who's going to catch the baby? Do you want to have the antibiotic ointment for the baby's eyes? Or do you want to have vitamin K shot or the Hep B vaccine? Do you want to try to use that's the other thing is you can have, I want these options to try. Like, I want to try these things, and you might not want them at the end of it. I want to try getting in the water, in the shower, because hydrotherapy is so nice, let me tell you what. But you could try that and be like, hey, this ain't it. I do not like this anymore. Let's go somewhere else. Or I want to try heat therapy or cold therapy, and like just...
Or a labor TENS unit.
Yeah, a TENS unit. I love a TENS unit.
It's truly magical. It feels like a massage. It's nice.
Yeah.
Who doesn't want to get a massage while they're in labor?
Me.
You don't?
I don't.
Oh my gosh, I would love it.
No, my poor midwife / doula.
Oh, I mean, I don't want to be touched, but like...
Oh, yeah. She tried to rub my back at one point when I was pushing with Amelia, and I literally told her, no touching.
What an awkward conversation, but also have that on your birth list.
Yeah.
Your birth plan.
Yeah.
I don't want to be touched.
Or I don't want my mom in the room. Don't let anyone else come in. That's something else you put on your birth plan.
Or I only want them to come in when I'm pushing. Just all of everything that you would envision for your birth. Honestly, again, going in prepared helps you so much. Like, you just don't have to think about it. You can be in the moment because you've already thought about what you like and what you don't like.
Yeah, and it's really helpful when you go through that with your partner too, because then you guys have talked through stuff. You've given your opinion. If he has opinions, he can give them. I say that like that because a lot of times the dads don't. They just say, it's your
like
body.
Your wedding.
Yeah, it's very much like the wedding.
Whatever colors you want, babe.
Yeah, I love those flowers. Sure. Yeah. I'll cut the cord. It's very much like that. But so then they're in the know as well. So when you're going through the contractions, when you're going through labor, you can be present in your body and really not have to be in your head at all. And instead, your birth team can be there talking on your behalf, saying, this is what she wanted. This is this kind of stuff that she's thought through. And yes, we want this. No, we don't want that. So then you don't have to make these hard decisions in the moment, because honestly, that is the worst time to make a decision, is when you're going through labor. You're probably tired. You're probably hurting. And you are very hormonal and don't want to talk already. So why are people making you talk now?
Yeah, which goes into the next question, which is, how can a doula actually help during labor?
Oh, I'm glad you asked. Now, doulas do not do the medical stuff. They don't check you. They don't do IVs. They don't do your blood pressure. And they also don't take the place of the dad.
Correct. Yeah.
And I've had that
Super
question
important.
a lot. The purpose of a doula is having a professional birth partner. They're someone who prenatally, and every doula is different. They have different packages, they have different techniques, they have different experiences and different philosophies behind birth. So there really is a doula for everyone. There's no real feeling of competition in the doula world.
Yeah.
Because if I don't work as a doula for you, I don't want to be at your birth because I want you to have a transformational birth. Like, I don't want to be what holds you back from having that experience.
Which I think is so beautiful when it comes to like the birth world, specifically with doulas, is that there is this common knowledge of, if I'm not your doula and I'm not going to be helpful at your birth, I don't want to be there, because I want you to have an amazing birth, and having me be there and be stressful for you is not going to create an amazing birth.
Not at all. So what doulas do? Prenatally, they'll probably meet with you, talk about birth. They might give you some childbirth education. I have a course actually that I give all of my clients, just included in my birth packages, but I also have it for sale separately. It's like this all-inclusive from the beginning of labor, or from the beginning of pregnancy to postpartum. There's breastfeeding, there's nutrition, there's pain management and mental stuff. Like, it's everything. This course is like gold for me. I love having my clients go through it, because then I know they are fully educated on birth and know what they need to know going into it. So then we can really work on bonding and me getting to know them personally.
And I was going to say, side note, as amazing as doulas are, if there's not like actual birth education, I highly recommend that you go out and find it. I love evidence-based birth education. Their childbirth education is amazing. I know Amanda's is really amazing. I went through hers, I think, with my second.
Yeah.
And yeah, I highly recommend it, because as a woman, you want to and need to know what's going on in your body, because it will help you through the process. Instead of thinking something is happening to me, you're like, oh, this is what my body is doing. So you feel more included, you feel more aware. Overall, it just helps the whole experience. But also, doulas are there, as much as the doula is there for you as the woman giving birth, they're also there for your partner to make sure that they feel loved, that they are taken care of, that they are fed, that they have water, so that way they can be there for you in the way that you need them to be.
And the doula also helps your partner get involved.
Yes,
that is
absolutely
one of my favorite parts is, and I know I've talked about this before, but telling the dad, like, hey, how about you offer her some water? Or, hey, what if you squeeze her hips like we talked about before? Or if he doesn't remember, here, we'll do it like this. Ask her, does this feel good? It's very much hand-holding for the partner as it is for the mom. And one of the more important parts of that is making sure that everyone is on the same page, and we know, like, we've practiced different things, which is why the prenatal appointments are so important. So we all are on the same page going into it, because you could totally have there's some hospitals that have doulas on call that are volunteers that show up for a shift and they help moms, but that's just another stranger who, yeah, they're dedicated to staying in your room and helping support you and changing positions and suggesting different things, but they don't know you personally like a private doula would. Not that there's anything wrong with them. If you don't have the finances to hire a personal doula, a private doula, that's fine. Use the hospital's doula, but definitely have someone who has gone through birth before or has been educated on that there with you.
Okay, so the next question is, what do you wish someone had told you about the first week of postpartum?
I have a really good answer for this. Stay in bed. Stay in bed.
Yeah.
I was awful. With my first, I lost a little bit more blood than I did with my second. So actually with my first, I did stay in bed for the whole week, and I was just chilling and relaxing, and I didn't feel great, so I stayed in bed. The second one, I was like, hey, this is awesome. I feel great. I went to a wedding 6 days postpartum, and I was dying the next day. It felt
hilarious.
Awful.
I think for me, something that was weird that I didn't know I would feel is when family would come over, friends would come over, and they would want to hold my son. within like 2 minutes of them holding him, I immediately wanted him back. And I felt so guilty about it because
Yeah.
I don't know, I just like sharing things and, you know, sharing my life with people.
Yeah.
But yeah, a weird thing was like I wanted to hold my baby, which isn't weird. It's actually biological. And there are some people where they don't let anyone hold their baby for the first 14 days because it creates such a strong bond, which I've always, like with my second one, I would say I leaned more that way because of what I felt with my first.
Interesting.
But yeah, and I would feel guilty asking for him back. Can I hold my son again? And yeah, I think that's a personal thing, but that was a weird thing that I experienced. But I just wanted to throw that out there. If anyone else has experienced that or thinks about it, it's not weird. It's not strange or anything for you to want to hold your child and to be kind of.
Oh, yeah.
Oh, something else that happened in postpartum for me that I didn't hear anyone talk about was I got postpartum carpal tunnel. I was like really taken aback by it because I was like thinking something was horrendously wrong with me. But I just had horrible knots in my shoulders from nursing and from being hunched over and things like that. And so in the middle of the night when I would go to pick up my son, I had my pinky and my ring fingers were both numb. Like I couldn't feel anything. And then half of my middle finger. And I would go and try and pick him up in the middle of the night and I have shooting electricity going down my arms. Now, keep in mind, this did not happen with my second baby. So with my second one, I was totally fine. And I knew that after having those symptoms for a couple of weeks, and it primarily only happened at night, I knew that I just needed to stretch my neck and relax and do all of those things. And after doing that consistently, it went away. But that was something that no one ever talked to me about, is that postpartum carpal tunnel is a thing.
Yeah, prenatal carpal tunnel is too. And I didn't know about that until I had it with Jacob. So I've actually had it with all three of mine. I have prenatal carpal tunnel. And then I had postpartum carpal tunnel with my second, which lasted probably until I was pregnant with my next one. But that and pinched nerves in my shoulders were the worst things. One other thing that I realized, and no one talked about it at all, I had no idea it was a thing. So everyone knows, like, postpartum depression is a thing, right? Postpartum anxiety is also a thing. So I knew to keep an eye out for those with both of my first and my second, and I didn't have that at all with my first. And with my second, I couldn't really tell. I didn't think I did. I probably had a touch of both, but what I didn't know was a thing until way later is postpartum rage. I had postpartum rage with Aiden, and I had no idea, and my poor husband is a saint for dealing with all of that. Not that, like, I mean, obviously it was affecting me too, but I took it out mainly on him, and he loves me still, so that's a plus. But seriously though, postpartum rage, I felt so terrible because it's this cycle of guilt because you're snapping at your toddler and baby, but then getting angry because you're snapping at them and guilty for that and feeling guilty and the mom guilt and all of that. But then also there's the sleep deprivation and the other hormonal stuff and the mastitis and all of this stuff. So you have such a short fuse and it feels in the moment. For me, when I'm like PMSing, when I'm pregnant and postpartum, like I can tell, and it's almost an out of body experience. Like I know that I'm being, like, something's going on hormonally where everything is amplified. It to the point where when I'm pregnant and I'm crying and I know it's for no reason, like it's not, like there's a reason obviously, but it's not a good one in my opinion for myself. I literally will laugh, sobbing, looking at my husband saying, this is ridiculous. And he knows he can laugh at me when it comes to that. But in the moment when I was having postpartum rage, I felt like I was being ridiculous for being angry at things and being so quick to anger and frustration. I'm mad, like I'm angry. This is pissing me off or whatever. Like, how about you nurse the baby? And it's just so, looking back, I felt so lost in my anger, but at the same time, I felt so irrational in it too. And I had no idea that was a thing until I had finally come out of it. I don't even know when I came out of it, but I definitely did at some point. And this time around, I've been able to keep an eye out for any symptoms of any of that. And I haven't, thank God, experienced any postpartum mental anything. So that's been really nice. But it still is a thing. And on that note, we haven't personally experienced it, but I know that not everyone knows dads can get postpartum depression and postpartum anxiety and postpartum rage and all of the postpartum mental stuff that happens. Dads can get that too. Adoptive parents can get that too. Like, it's not just the parent that's birthing. It can be any parent involved.
Fun fact, men who sleep with their baby or who have their baby sleep in their room, their testosterone levels drop significantly until the baby graduates and goes outside of the room.
Huh.
Yep.
Do we know what that is?
My assumption, if you think back to like cavemen, like you want, like biologically, it was better for a caveman who's focused on survival to have a lower testosterone level, a more nurturing side when there's an infant or a baby around. So that's my assumption, is that's why. So that way they're a little bit more nurturing, because the more testosterone, the more like, aggressive they are.
Mm-hmm. Interesting.
Yeah.
Okay. Next question.
What's something random that helped you in labor that no one talks about? For me, there were a couple of different areas. One of them was obviously deny. Like, I just was in denial, and it honestly really, really helped me with both births. And then in addition to that, a consistent thing that I had with both of them was I was constantly moving. So for me, what really helps me, again, everyone's going to have their own experience and things that help them the most. But for me, it was rocking my hips back and forth, left to right, side to side. That really, really helped. And then the other thing was I used the TENS unit, specifically labor TENS unit. There's normal TENS units, and then there's a labor TENS unit. And what happens differently with the labor TENS unit is that there is a consistent sequence that the TENS unit will use just normally.
And then explain what a TENS unit is.
A TENS unit is a electronic machine that has adapters, I guess I'll say, that connect or that you put on your body. So like for labor, you'd put it on your bra line and your panty line, and then
your back.
Yeah, on your back. And then it would disperse a electric pulse, and it will tense those muscles, contract those muscles, and release really quickly. So sometimes people will do it to relax their muscles after a workout, or in physical therapy they use it, things like that. So for labor specifically, you put it on, and you want to put it on early, or as early as you can. Anyways, so it disperses a specific sequence, and then when you're in a contraction, you hit a button and it does a different one. So it causes that muscle confusion or that pain confusion. So that way your body is unaware of what to go after. And for me, that really, really helped.
And you can actually, I've seen and had clients who've used just a normal TENS unit that they got off of Amazon too. And they just turn up turn up the intensity of the TENS unit when they're hitting a contraction. And then they turn it down when they're done.
And they also don't sell any labor TENS units in the US anymore.
Yeah, you had to order it from the UK, right?
Yep.
Rough, dude.
Yep.
So the next question is, how do I know when to go to the hospital? That's a great question. There are a few answers to this. The general rule of thumb is if your provider gave you a list, because everybody is different and we are not medical professionals. This is not medical advice, anything that's said on this podcast ever. If your provider says, hey, XYZ, you need to come in, those are obviously, you go in for those. And this is when you're in labor, or not if you're experiencing these and not in labor, if you experience any kind of bleeding more than just a little bit.
Yeah.
Then go in. There can be something wrong. There might not be something wrong, but it's always safer to go in and get checked. If your water, so some providers will tell you if your water's broken, come in. That is up to you. My advice is if you decide to stay back and not go in yet, when you hit the 24-hour mark, go in, because you don't want to get an infection, and you are at higher risk of infection the longer your water stays broken. If you start to run a fever, that is a sign to go to the hospital because you might have an infection. So the next thing is, if it's your first baby, 411 are the numbers that you want to remember. Contractions that are 4 minutes apart from the start of one contraction to the start of the next one, and they last 1 minute long, each contraction, and it is consistently that for an hour. That's when you want to go in for a first-time parent. If this is not your first baby, 511 is the number. So when they're 5 minutes apart from the start of one to the start of the next, because everybody knows that the second baby comes faster, right? Not really, but your body's more used to labor, and it
knows what it needs to do.
Yeah, you've done this before. You're used to labor a little bit more, and that's just really good time to go in. Another way to know that you should go into the hospital is you can tell where you are in labor by how you're acting. And by you can tell, I mean we can tell. If you're able to talk through the contractions, walk through them, just hanging out, chilling with everyone, oh yeah, there's just a little contraction, you're not there yet. If you are talking and walking, but it's a little labored, that's a little further in, the less interactive you are during contractions, the more progressed you are. Once you get to the point where you have to do a moan to get through the contractions, even if it's under your breath, like a kind of a sound, which is amazing to do, by the way. Mm-hmm. Please vocalize while you're in labor. It is so helpful to help with all of the contractions, all of the intensity of them. If you're doing that, it's probably time to head in. Probably get checked, see how things are going, see if your water broke already. Like, you can also get it checked then. They do like this swab thing to see if your water is broken.
Yeah.
Also, if you have a doula, call your doula. Have them listen to a contraction or two over the phone, if they're not already yet with you. And they will be able to tell you whether or not you're ready to go in, or they won't tell you, hey, go in, but they'll suggest it. Very similarly to how Kirsten and I were FaceTiming while she was in labor with her first. And I told her, yeah, you should probably call a midwife to come over. Yeah, that's kind of it.
Yeah.
So I think we'll wrap up right here. It's getting late. We have babies to get back to.
Awesome.
Thanks for joining, Kirsten. Kirsten is going to be here with all of the, or most of the Q&A sessions. She is equally a wealth of knowledge, so it's fun. And she's also my sister, and I like her, so.
Oh, thanks.
Yeah. Got to keep her in the birth business somehow. Not that you're not, but you're taking a break.
Yeah.
Anyway, that is it for today. Thank you so much for listening. Thank you, Kirsten, for being here.
Yeah, absolutely.
If you have a question, like I said, fill out the form. All of the links you need are in the show notes. Share the podcast, subscribe, sign up for email notifications, even leave a review so more moms can find out about this podcast, because we really, really, really want to shout from the rooftops that birth is normal, birth is to be talked about, and birth is to be celebrated. Anyway, that is it for today. Thanks for listening to us. We'll see you next time on Let's Talk Birth.